So I want to go over what we do for all patients, whether they're coming in for a complete examination or a limited examination. I like to do the hard tissue chart. I also call it the white sheet. And we just attach this to the patient's chart. But it's just a quick synopsis of what's going on, and it helps me build my schedule. So for later appointments, it builds my schedule, and it also helps complete and build the hygiene schedule as well. So this starts off, you'll see here in the upper left-hand corner, the patient's got the name, the age, the date. There's a dental IQ, which I usually put in at the end of everything. So when we're all done, I'll do the dental IQ. Then we have the upper area here is really helpful too. The pre-med, the diabetes, high blood pressure, latex allergy, heart conditions, artificial valves, allergies, and blood thinners. So the first thing I always do is I go through and find out what the chief complaint is. We want to make sure we have the chief complaint here, and that's important because if a patient's coming in for just a limited examination, we want to put that down. Patients having pain on lower right. They're coming in for an emergency examination, and that needs to be written down because there was one lawsuit that actually I was part of where a patient came in, and she was actually a paralegal, and she came in, she had a broken tooth on the lower, and they just did a limited examination, which is reasonable. They did that for the patient, but then she never came back, and then 6 months later, the office was getting sued because her sister was a hygienist, and she said, I can't believe you went to a dentist. They never told you that you had severe periodontal disease, and that's supervised neglect. So who was your last dentist, and why didn't they tell you about it? Well, the person came in and they put down chief complaint was just a limited examination for one particular tooth. So that person was not held responsible for diagnosing the periodontal disease because the patient wasn't informed that they needed to come back for a comp exam. So it's always good to have a chief complaint. So we put that down first, and then I like to go through like pre-medication. Obviously, if they have artificial joints, we want to make sure we know what pre-medications they need. And pre-medication should be something that the orthopedic surgeon, if it's an artificial joint, or the heart cardiologist, should give the patient so we have in the chart. So if we need to refill it, we can, but it needs to be under the discretion and direction of their specialist or their doctor. Diabetes is another important one. We want to make sure that diabetes is circled because if we're doing implants, diabetics usually have a higher failure rate with implants if it's not controlled. Same thing for sugar levels too. The sugar levels are not controlled. Their immune response, maybe they have a higher amount of areas of decay because their diabetes is not under control. So we want to make sure we know that. High blood pressure as well as heart condition. That's another thing I want to know if the patient's taking any medication for that, because a lot of blood pressure medication as well as high blood pressure or heart medication causes the patient to have a dry mouth. And people with dry mouths have a higher tendency for decay. So we want to make sure we understand whether they have issues and they need to be placed on fluoride. Obviously, latex allergy. There's still some latex on certain products that we have. Bibs, the underside sometimes has latex. So just be careful of that. And then obviously allergies. We want to make sure we know about any allergies or blood thinners. That's important too for deep cleanings or for extractions. So that's important to have. And then we'll put down what meds they are taking and what they're allergic to. Then we go through oral cancer screening. I like to just double check that for a patient. Patients really like to hear that they have no cancer. And I've done it for a while now where I tell the patient, oh, good news, no cancer. After screening you, doing a soft tissue examination and checking the lymph nodes, it looks like there's no cancer currently. And they really like, oh my gosh, no one's ever done that for me before. They're really impressed when the doctor says that. So that's nice to know. Then we go to any types of oral cancer screening that you do see, either put with normal limits or whether they need a biopsy. Then we go over to